cheat sheet up there if I need it. All right. All right, so this is Adam. He's my patient for the GVU MSAT heart auscultation video. Adam, all we're going to be doing is listening to a few spots on your chest for your heart. Take a couple minutes. Is that cool with you?
Yep.
All right,
Absolutely.
perfect. All right. So we are going to start with that second intercostal space on your right side. So just sit up tall for me, breathe normally. Good. And we'll go just right across to the second on the right. Good. And we go down to fourth intercostal. Good. And then midline clavicular down. All right, cool. That is literally all I need to do for her. Awesome. Okay, so just had my patient listen to his 4 spots on his chest for the auscultations. So the sounds we're looking there for normal sounds are S1, S2, and then S3. So that S1, S2 is that lub dub that, you know, everybody knows. So that lub, that S1 is caused by that mitral and tricuspid valve closure, which occurs essentially at the same time. That's kind of what it's like, excuse me, it's the blood being pushed through the heart, that initial contraction, and then the valves opening, things like that. So that's the lub. The dub, the S2, is essentially, it's the closure of pulmonary valves, or aortic and pulmonary valves. So that's, the dub is just those valves just shutting closed at the end of the contraction of the heart. And then it restarts, but you also have S3, which is the ventricular gallop. So the S3 is this like low sound. It's not a lub or a dub. It's just kind of just a quiet filling noise in the heart. And what this is normal in healthy individuals, pregnant women, and kids. So someone who's like a trained athlete, so college athletes, professional athletes, pregnant women, children, for the most part. But all that is the heart like passively filling with blood, and it's just essentially like the gap in between S2 and then S1. So S2 happens, that dub, and then it'll quiet, you'll hear that passive filling, and then that heart will contract again, pushing that blood out. In older people, this can be a sign of like some kind of heart failure, but in younger populations, as long as they're fit and healthy, it's not really anything to be worried about.